All right, with that, ladies and gentlemen, it's now time for us to hear some knowledge insights from our next pharma expert. He is a medical consultant, pharmaceutical and management expert with more than 2 decades of experience. He presently serves as the Director of Strategy and Business Growth at Gloderma. So ladies and gentlemen, without much further ado, please make a roaring round of applause for the one and only Dr. Mahesh Abhyankar. So while Dr. Saab joins us, let me also tell you that apart from being a pioneer in his field of work, Dr. Abhyankar is also a best-selling author. So during the pandemic, while we were stuck at home and looking for new skills to develop, Dr. Mahesh had immersed himself into curating his fictional book titled Emozeal, Saga of Emotional Lockdown, which talks about the experiential journey of real people who face hardships and emerge as a champion with a zeal. So ladies and gentlemen, that's Dr. Mahesh for you. Let's welcome him with a big round of applause.
So good morning. Today my topic will be revolving around real world evidence and go to the slide. How to create data and how to disseminate it and use it in a strategic business growth. Now, when I put this particular Pharma in Futures message to around 200 to 300 colleagues which I interacted during this particular period of time, last 20 years, many told that we are busy in the Gynec conference in Calcutta. Some of them told that we are in brand plan, right? So since everybody is in the phase of brand plan, it is very essential is that what is the marketing and sales people look while making a brand plan, and what is the new incorporate, what are the different dilemmas we face, right? One of the dilemmas is how to emphasize the same unique selling point. 20 years back, leocetrizine was launched with two benefits. One is faster onset of action and other is less sedation. And today also the visual aid has got the same 2 points. And that is true with virtually every product. The another important thing is what new I can introduce. That is the most important point. The another point is how to differentiate brands. When there are 100 of omeprazole available, how I can differentiate Ocid and Omaze from the other competitors? Or there are 100 atorvastatin or rosuvastatin available, how I can differentiate into the segment? And the last important point is how to make brand big. That is for we get salary on 1st of every month. And when you are managing a portfolio, when there are drugs, okay, we have got some data which is available from the global side. The next is FDCs, because India is very much expert in FDCs, right? Double, triple, the data becomes less. Then you go to the sustained release formulations and controlled, and these are the formulations made by us. The data is still less. Then we have got something in nutraceuticals in hand. There is only a concept, there is no data. And now we have got Ayurvedic and herbal formulation also, right? So that is another. So as you go on down the ladder, the data is going to be lesser and lesser. So what is important is that how to create a sustained competitive advantage in the current scenario. How? So there are so many ways. I think today you are going to discuss about almost 10, 12 different ways. One of the ways I am putting today is basically creation of data and dissemination of the data. Now, why this is very, very important today is because without data, we are deaf and dumb, right? Everybody knows the story of 4 blind men, right? So it's very important is that we have to look at every parameter from 360 degrees angle, and then only we get a right perception about a particular thing. Today it is a data asset. The AI will be a future because this conference is Pharma in Future. And there will be tremendous AI which is going to be in the next 10 years. And we all will be a part of this AI. Big data will be a mega trend in the future. Clear? So I think this millennium can be called as a data millennium. 20 years back when we started our careers, or 30 years back, this kind of data is not available. But if you look at next 10 years, it's very, very important is that how much data we are able to collect. That is, one is information flooding which is happen, sorting that and making a very nice input out of it, generating insights into the data which is there. That will be the very, very critical factor when you consider the marketing and selling in the future. So if you look at this particular statement, what is the statement talking about? Many times tell that the product is very good. We mentioned on the visual aid, the product has got a quick onset of action. The product is very smooth on the skin. But this is called as an opinion. This is called as an opinion. But when you put out the data, especially from the customers, let us say 1,000 doctors are talking that my molecule is superior to the competition, or my sustained release technology is better than the competitors, then what will happen is that these opinions, which are gathered from 1,000 doctors who are our customers, this whole data is going to speak. And it will not going to remain opinion, it is going to be a very, very important, fruitful data. And this particular data is basically called as real world data. What is the definition of real world evidence? Real world evidence basically derives from the judgment based upon the real world data. And whatever the real world data available about our medicine or our disease portfolio, or a subgroup of disease population, subgroup of patients, subgroup of people, all this is very, very important. So insights derived from all the information which is available today. And I think China and India are the two countries, being the biggest populous countries. The data which is available with China and India matches with all the global data which is available, right? Way back in 2003, when I was in Cipla, I was also in one of the conference where a psychiatrist from US was talking, and I was sitting, one other psychiatrist, a leader was sitting, and there were 3 talks of ours. And at that time, the USA doctor, he presented olanzapine role as an antipsychotic drug, and he presented a data of 25 patients. And when India doctor started talk, he talks that this 25 patient I see daily. So that's a huge difference, that the data which we are having, or the doctors who are having so much of electronic medical record data, we can definitely use that data to create the evidence. Now, what are the different sources of real world data? One of the sources, if we are conducting trials, I think majority of the companies have got research department. Whenever you conduct trial, don't restrict to that only trial, because from the trial only you can get more data. What we call it as a subgroup analysis. Even if you conduct a trial on 100 patients, you can get a data from that. And subsequently you go on publishing a 50 patient data, data in elderly, data in females, data in some subgroup of disease profile, anything. The next important point is the real world trials. I think this is a very, very essential point today in today's world, is that as a company, it should be a strategy that I spend something on collecting a data through a proper real world trials. And today these all companies which are into apps, they are going to be very, very useful in the registries. Everybody who is marketing knows that there are majority of the doctors, they have got their own registries of the patients. Insurance claim, globally if you see, this Mediclaim which is available, and the data in this Mediclaim is huge. So during one of the tenure, when we were defending canagliflozin, when there was a small amputation problem started, immediately within 3 months, the company came out with 1.5 lakhs patient data, that when it was used in the real world, there was no amputation risk. Clear? So that is the data which is available. India is evolving. I think still the insurance data or Mediclaim data is relatively evolving stage. But when we talk about 2025, 2030, that will also come into picture. Electronic health records of the doctors, hospitals, and the health surveys. Now, if you go by the marketings, which are going to be very, very important in terms of feasibility, what is the best feasible option? The best feasible option first is health surveys. Daily on our mobile, somebody puts a survey or no? Survey opinion about something. May not be related to medicine, may be related to 1,000 other things. So, conducting a health survey from the doctors, from the patients, from the people is a very, very simplest way a digital tool can be used for putting it into. And you get the whole data that how many doctors have replied, what are their specialties, what is their age group, where they are practicing, and what is their opinion about your own product. The next important feasible option is electronic medical health records. I think around 10 years back, I have gone to one of the doctor in Vashi about asking the data about one molecule, and he has set up an electronic medical record. He just typed the name of the molecule, and he was having 2,000 patient data. Because last 6 to 7 years, he was using it. Just capture that data and use it, right? That is another important point. So, electronic medical record, there are a group of Apollo hospitals available, Bombay hospitals are available, there are chains of Kaya clinics which are available. So, gather the data from 5, 6, 7 institutes. Even if you gather data of 100 patients, 5 institutes, you will get a data of 500 patients about our own drug or molecule. The next is real world trials. I have got a huge experience in these domain for last decade. You should initiate as a brand plan that real world data or real world trial as one of the very essential for the futurist, current as well as futuristic point of view. The next is registries. I think in India there are 100 registries are ongoing based upon the disease. I have put up only 3 examples. There is a heart failure registry going from Kerala. You will get a registry of even a niche segment like ADHD. You will get a cancer, each and every different cancer. So, actually, whatever disease you are into it, you will go into diabetic foot, you will get a hypertension, kidney disease. So many registries are there. Put up that data from registries. Let us say heart failure registry has got 1,000 patients, and I am marketing metoprolol. So, what is the use of metoprolol in heart failure? I can easily get a data of 1,000 patients, that in which different categories of heart failure metoprolol is used, what is the dosage, and how much time it has been used, all the data which is available from the registries. And insurance claim, as I tell you, it is in the nascent phase, and supplementary information from the trials. So, this is one of the picture which I have taken. Now, if you look at some of the points, that is, this is about mobile health. From the mobile, the another thing is if you see patient reported, the next is social media. So, the data also can be collected from the modern media which are available. What are the patient commenting? What are the doctors putting on the websites of their own as well as on Twitter or Facebook? The data can be collected from all the social media platforms about our own drugs. Now, just I was sitting there, and before coming to the presentation, I put up www.pubmed.com. I put a real world evidence, and there are 98,000 references. How much? 98,000. In the last 5 years, almost 50 to 60,000 have come from last 5 to 6 years. So, this is an example, vildagliptin. Another example, budesonide formoterol, a Smart Asia study. So, it is a segment of asthma. If you look at even in dermatology or even in the ophthalmology. So, every disease and every drug, you will get a huge data about the real world. And we are used in this promotion. Only thing is that this is the story which is foreign story. Today I am going to talk about what is my real story and how I was associated with a lot of data throughout my career. The first and foremost, when I started my work in GS Medical College, KM Hospital, which is one of the largest institute and among the top 5 medical colleges in India. Now, there are 2,000 patient bedded hospital from so many years, and every OPD has got daily 10,000 patients plus. So, the data is generated on daily basis. in the OPDs as well as inside the hospitals. Later I got an opportunity to work in intensive care unit settings, Asha Parekh as well as St. Elizabeth Hospital. You will get immense data about the intensive care unit setting, injectable antibiotics, and all kinds of cardiac medicines. Now, one of the points for marketing is that is the real world data very important at which product life cycle stage? So today I am going to show you all the examples what I have gathered over a period of time. In way back in 2004, I was associated with Universal, and there was a drug called as coenzyme Q10, CoQ10. I think today it is more than 100 crore brand. What is important is that whenever you look at nutraceutical, many times there is only a concept. So coenzyme Q10 and male infertility, there was a concept that coenzyme Q10 can increase sperm motility, count, all those things. At that time, the capsules, it was 16 rupees a day, a 16 rupees capsule, and the daily therapy was 48 rupees. So it was very difficult that 2004, 50 rupees per day, along with all the standard medications for infertility. So there we started collecting a data from doctors who started using coenzyme Q10 and who started getting benefit that there is an increase in the sperm count or sperm motility in the clinical settings. Even it may be having around 100 patients data, but that has given a confidence to the brand that the coenzyme Q10 can work, right? And coenzyme Q10 can show the benefit in the Indian patients. And then this has become a very important point. They collected later on data of 500 patients, 1,000 patients. And today, definitely, when we market a nutraceutical, and that nutraceutical shows the benefit in the patients, the confidence and the brand thoughts becomes stronger. Then I was part of what is called as a story of aceclofenac, paracetamol, and serratiopeptidase. Now, at that time, there were some Japanese studies they were talking about. The serratiopeptidase doesn't work, right? And I was associated with IDMA, Indian Drug Manufacturer Association, Medical and Nutraceutical Committees. So at that time, there was started a concept of FDCs are going to be under scrutiny. It was, I am talking about 2008-9 kind of a story. And you know the famous committee, this particular Dr. Kokate committee, which has really has done a great checking for all the pharma industry. 500 products, 400 products. And this aceclofenac, paracetamol, serratiopeptidase is going to be under scrutiny. It was understood because of the triple FDC. So what we have done in 2009 and 10, we collected a data of almost 1,000 doctors and various specialties, orthopedics and ENT, surgeons, dentists, whoever is using. That is the first thing what we have done. The second what we have collected is that the orthopedic HODs of various medical colleges, almost 100 medical colleges, we collected data that this particular drug works in the short term or as well as slightly moderate term. And the next important point is even the patient data, almost 1,000 patient data. So before the Kokate committee was set in, our data was ready. And because of that, from the Kokate committee, we are able to save this particular drug because the data was evident. And today, this is a single-handedly 100 crore brand. And overall, this brand portfolio is around 350 crores. So what is important is that if you are going to data, and the same mistake I have seen when I visited DCGI during the Kokate committee meeting for molecule pioglitazone, the pioglitazone 7.5 milligram strength along with metformin, the Kokate committee rejected it, and big companies which are having this molecule, they don't have got the data in spite of their selling around 100 crores. So they are not able to produce that data, and 7.5 milligram pioglitazone was rejected by the DCGI. The next is a story of a beautiful brand. I think this is a brand which is number 2 brand in the pharmaceutical market after insulin, glimepiride, metformin. When I launched the company was having a very, very big stake, almost 300 crores. And the sulfonylureas were in problem because all the guidelines, ADA guidelines, European guidelines, they were talking about DPP-4 inhibitors are good, glyphosines are good, and the sulfonylurea started coming to as a number 3, number 4, number 5. And if you see the current guidelines, the sulfonylurea come down. So what is important is that how to maintain a legacy of such a big brand and how to take the big brand from 300 crores above. So one of the strategy we adopted, in spite of 300 crores, the data was not there about the molecule in India. So what we have done is that in the next 3 or 4 years, we conducted so much of real-world studies. All the studies are published in the reputed journals. And there are millions of patients taking this glimepiride metformin. The data is huge. Only thing we have to gather it. So we have given all the shades of glimepiride metformin. If you look at glimepiride metformin, let us say vis-a-vis sitagliptin metformin, then the use diabetes comorbidities with other OADs, with other insulin, a triple combination with voglibose. Even during the COVID also we conducted a trial, COVID-19, glycemic control with the drug, triple combination, obese patients, and there are ongoing trials in the different indications. So today, if you look at glimepiride metformin and India, what is important is that if you look at these studies, you have got a data of more than 15,000 patients. The sales and marketing positively supported all these real-world studies. So that is also a very, very important critical point. So even if the drug is at maturity stage, if you generate data, the molecule currently is going towards 500 crores. You can definitely take it into a next ladder. What about declining phase? Even I got to experience that you can stop the decline and you can make a 2%, 3% growth of the molecule. And this is a famous molecule, metoclopramide. When domperidone got introduced, ondansetron got introduced, the molecule becomes stuck. But there are so many doctors using this molecule from their college days. We started collecting the data, the doctors giving video clips of 30 seconds, showing that when I was doing a residency at this medical college, I used to use so much. And today also I am using. That given a confidence for our field people, it has given a confidence for the doctors. And you don't surprise that we conducted a round-table meetings on a molecule which is declining. And the molecule got into small growth. That is very, very important. The future is faster. This is a pace which is called as a standard pace. And what we have seen during the COVID time, the linear pace has to be changed because we have to grow in an exponential manner. If I have got a brand of 20 crores, I can't project it next year I will go by 20 to 24. We have to think big when we make a brand plan. So during the COVID times, we got opportunity with vitamin D. We have done a real-world data about vitamin D, publications, almost a data of 2,000 patients, 2,000 doctors' opinion got published, and the molecule from 40 crore as running towards 80 crores. If you want to go for blue, this is called as blue ocean theory. The vitamin D was there in osteoporosis, in cardiac diabetes. Now the vitamin D is there in immunity. And this is called as the blue ocean theory. So you want to increase the indication usage. I have got so many examples during my time. It's metformin in pre-diabetes because there are 8 crores of diabetes. There are 6 crores of pre-diabetes. There's an example of paroxetine, metoclopramide, azithromycin, chloroquine in off-label indications. So what is important is that when you want to fill up the gap of brand and when you want to plan a big growth for the brand, you can use real-world evidence as one of the strategy for growth. And I think everybody sitting here is a master of data dissemination, right? Once the data is there, how to disseminate, you are the expert. Starting from the LBL to Insta and Facebook, all you will do a very effective manner. So whether this whole real-world evidence will give a strategic business growth, the answer is capital yes, big yes. So summarizing the point, the real-world evidence will it will create a data for your own molecule, right? Don't depend upon the data which is published by multinational companies across the globe. it will give new dimension for the promotion. Naya kya hai? So this is a naya data hai, right? So now glimepiride metformin for next 2 years we'll talk about 15,000 patient data, which is gathered from the Indian patients. Differentiate from the competition. If there are 20 brands, I have got a data of 5,000 patients. That will give you edge over other competitors, even if they have got the same molecule. Blue ocean strategy. You can explore newer avenues and indications. Obviously, this will help in two ways. One is that the current doctors going for convergence, which is the cells, and the new doctors. Postgraduates, they don't know about your molecule. Because the doctors who are coming in, they will look at the guidelines. They will look at the guidelines, and in the guidelines, when the product comes on the third or fourth line, they are not going to accept. So this data will give a confidence for the new doctors. And I think the most important is that after this 194, it is very important is that we have to identify some new and good CRM models. And this is a very authentic way of CRM model when you talk about, because you are doing a research or gathering a data in a very systematic way. And you have got publications. When the name of the company, name of the brand comes in the publications, it will build up a good image for the brand as well as image for the company. Thank you.